Thank you so much. Truly fascinating to hear about your work with this indication. Our next speaker is Joel Castellanos. Joel Castellanos is a medical director of pain medicine and rehabilitation at the University of California, San Diego. Dr. Castellanos is a board-certified physical medicine and rehabilitation and pain medicine physician and serves as a medical director of inpatient rehabilitation. He is also trained in integrative medicine. His prime focus is on improving function using an individualized integrative approach. His expertise with interventional pain techniques allows for an integrative strategy to preserve and restore function. While Dr. Castellanos welcomes and treats all patients with different types of functional impairments and pain, he has specific clinical interests in pelvic pain, complex regional pain syndrome, phantom limb pain, traumatic brain injury, and post-spinal cord injury pain syndromes. His research interests include altering nutrition as a means of treating chronic pain, neuromodulation for chronic painful conditions, as well as the potential use of psychedelics for these conditions. Please welcome Dr. Castellanos.
Thank you. Hi, everybody. It's really great to be here. Thanks for the introduction. My name is Joel Castellanos. I'm from UC San Diego. I want to start by introducing the group that we've founded, the Psychedelics and Health Research Initiative. We have a really strong group of humble, curious, and really intelligent and really well-experienced people, starting first and foremost with Mark Geyer, who is a co-founder of the Hefter Institute, has over 35 years of research experience in psychedelics. His understudy, Adam Halberstadt, who also is a very experienced pharmacologist and is working with Jason Wallach at the University of Sciences on the Discovery Center. Tim Furnish is my clinical mentor in the Center for Pain Medicine. Fadel Zidan is a mindfulness expert and our functional imaging expert. Cassie Veaton is a psychologist and mindfulness expert and author. Ethan Hurwitz is our PhD candidate, a really bright, up-and-coming researcher with really great ideas, as well as John Dean, who is our postdoc, who's not pictured here today. But I want to bring some focus to Albert Lin, who many of you may have heard speak in the past. He's a professor at UC San Diego. He is a Nat Geo explorer, a really interesting guy, and unfortunately, he had a tragic accident where he lost his limb, his lower extremity, and developed extreme phantom limb pain in the limb that's no longer there. Through collaboration with my clinical mentor, Tim Furnish, as well as Dr. Ramchandran at UC San Diego, he was able to completely resolve his phantom limb pain through psilocybin. Which is really what started this journey at UC San Diego about trying to develop a center that focuses on pain. Yeah, it's a big deal. I'm a clinician. I see patients in the pain clinic and in the hospital every day. Chronic pain is a big issue in America, with over 116 million patients suffering from chronic pain, which is more than diabetes, heart disease, and cancer combined. On an individual level, though, this is a big number. But on an individual level, when I'm meeting these patients in the clinic, this number doesn't matter because individually these patients are really struggling. When you're suffering from chronic pain, severe chronic pain day in and day out, it's socially isolating. It prevents you from being able to work. It causes comorbid depression and anxiety. People are afraid to go to physical therapy because they're afraid they're going to hurt more. And so, when I'm meeting these people in clinic, it's a really intimate moment. And these patients are really just looking for someone to walk down the path with them, be a teammate, and help get them to a better place. And as a field, as a pain medicine physician, I'm the first to admit, our field in pain medicine did patients wrong. You know, we relied on opioids to help kind of get these patients more functional, but even the CDC has said that we need to find new, more efficient, non-opioid treatment options for these patients. Many people in the field of pain medicine are now calling themselves neuromodulators. You know, in the field of pain medicine, we're in the business of altering perception. We do that through nerve blocks, through electrical stimulation on peripheral nerves and on the spinal cord itself, and even on the brain, as well as magnetic stimulation through repetitive TMS. This is becoming such a big movement within the field of pain medicine that one of the biggest pain societies is the North American Neuromodulation Society. And, you know, as I've grown up in pain medicine and kind of learned the rules of engagement, it always really boggled my mind that we call ourselves neuromodulators, yet we're completely ignoring these substances that profoundly neuromodulate our nervous system. And so, you know, in talking with Dr. Furnish, my clinical mentor, as well as our group, you know, it was something that we thought we really had to look at. And so, you know, we looked at the previous literature, and I know this is probably a little difficult to see, but, you know, there was a couple studies in the 60s and 70s that looked at phantom limb pain and showed that there was a signal there. And between that and what we experienced with Albert Lin, that's kind of where we decided our first venture was going to be. But I want to highlight this 1964 study by Castellanos, which looked at LSD in patients who were hospitalized because of severe pain. So these are patients who their pain is so bad that they don't know where else to go, so they get admitted to the hospital. And what they did is they compared LSD to two very strong opioid analgesics in Demerol, or meperidine, and Dilaudid. And what this study showed, I mean, it's an old study, it has its flaws, but it showed that after 3 hours, the LSD group outperformed the group that was treated with the strong opioid analgesics. And what really caught my eye about this study over that was that after 19 hours, you know, long after the effects of the LSD or the opioid of choice was used, almost half of the patients in the LSD group were pain-free. And that's a big deal, because in pain research, our goal is 30 to 40% pain relief. We don't hear about patients being pain-free after really anything we do. That's why we really have to have a multidisciplinary approach. And so the way I think about it in my mind, the way it may work is, you know, someone who's learning an instrument or learning a new skill strengthens their neuromuscular pathway by repetitive practice of that skill. You know, in the same way, people who have chronic pain day in and day out are strengthening that neuromuscular pathway associated with perceiving pain. And so, you know, this is borne out in functional imaging studies where patients with chronic pain syndromes, whether it's fibromyalgia, phantom limb pain, pelvic pain, or just central pain syndromes in general, they have altered functional imaging. And we know through other functional imaging studies that psilocybin can reset that chronic neuropathic maladaptive pattern to a more healthy default mode network. And so, you know, our theory with how, our hypothesis on how this will work in patients with chronic pain is to help kind of reset the patients to a more healthy, less maladaptive brain firing network and re-enter a state of global plasticity to get to a more healthy place. So this is a big deal. There's some studies that are ongoing right now. A lot of work in headache and migraine is being done at Yale up in New Haven. There's a group looking at fibromyalgia down at University of Alabama that's not yet recruiting. And then our group is getting ready to enroll for our phantom limb study. Our phantom limb study will be a double-blinded, placebo-controlled trial to not only look at yes or no, this is something, we want to obviously answer the question, does psilocybin help patients with phantom limb pain? But we also want to get some insight onto the mechanism. And we're going to do that through the work of Fadil Zidan and functional imaging, a functional MRI. Here's our trial design, very similar to the Johns Hopkins method, where we'll have a baseline fMRI study, have a prep session before the first and second drug sessions with integration sessions following the drug sessions, and then a post-treatment fMRI study. So I want to emphasize our group again, the Psychedelics and Health Research Initiative at UC San Diego. I think that we have a really good group of people that have been brought together who have different skills, you know, from basic scientists to people who can run functional imaging studies to clinicians, and we work really well together. So, you know, moving forward, we're looking not only at different chronic pain issues, but really interested in answering the question in the realm of neuroplasticity. You know, I see patients every day who have had strokes, who have had brain injuries, who have had spinal cord injuries, and their lives are forever changed. And it's really unfortunate when we run the gamut of things that we can offer them and they still are struggling. And so that's what really motivates me and our group to push forward, whether it's with psychedelics or other treatments, to really have an impact in these people's lives. So with that, I'd like to thank you, and happy to answer any questions during the Q&A. Thanks.
Thank you, Dr. Castellanos.